Hi there. You are listening to the Aligned Birth podcast. You have Doula Rachael here, and you have me, Dr. Shannon, both hosts of the show. And we are both here today to chat about a birthy topic. We typically sit and record, and we do long recording sessions. And so this is our number 3 recording of the morning. So I don't know if it sounds totally different from when we first start recording when we're bright-eyed and bushy-tailed. But we wanted to chat today about myth busting, some things in the prenatal and pediatric chiropractic world. So if you have maybe dealt with a provider, either for your child or for yourself, if you're pregnant, who have maybe said something as far as don't take your child to a chiropractor or don't go get adjusted during pregnancy because it's unsafe, or there's the force that's used or the hypermobility of the joints. We're going to kind of myth bust those things today to help you kind of understand that a little bit better. So yeah, that's the topic of the day. Good to have you here, Rachael. Welcome to the Aligned Birth podcast. I'm Dr. Shannon, a prenatal chiropractor.
And I'm Rachael, a birth doula and childbirth educator. Together, we're here to bring you conversations about pregnancy, birth, and motherhood. From cesarean to VBAC, hospital to home births, we've experienced it all. We are high school friends who reconnected through our shared passion for health and birth. As moms to 2 young boys, we've both changed careers after our own transformative childbirth experiences.
Join us as we discuss the importance of a healthy body and mind throughout pregnancy, birth, and into motherhood. Our goal is to provide fun, interesting, and helpful conversations and interviews that inspire learning. When your body, mind, and intuition are aligned, you can conquer anything.
Sit back and relax, or grab a notebook and take some notes, or maybe listen as you enjoy a walk. However you choose to listen, we hope you enjoy this episode of the Aligned Birth podcast. Before we get into the episode today, if you enjoy the content of this podcast, we would greatly appreciate your support in one of 3 ways. First, leave us a review or give us a 5-star rating. Your feedback helps us reach more listeners and make a bigger impact. Second, you can sign up for our newsletter. By doing so, you'll be the first to receive new episodes and exclusive bonus resources straight to your inbox each week. Lastly, you can become a direct listener supporter. Running this podcast requires significant time, effort, and resources. Your contribution, no matter the amount, helps us continue providing valuable content to a wider audience. Simply use the links in the show notes to make your donation, sign up for our newsletter, or leave us a review. Every contribution matters and is sincerely appreciated. If the Aligned Birth podcast is a part of your weekly routine and you love what we are doing, please consider supporting us through one of these 3 options. Your support will create a ripple effect, allowing us to reach more listeners and make a lasting difference. Hi, Dr. Shannon. So excited to be here with you on this lovely Friday morning where we're recording all these fun topics. I always enjoy doing it with you and learning from you. And I'm excited for this episode because I do feel like there's going to be some things I learn. And I think this is an important conversation because chiropractic care is, I believe, and I know you do, so important for overall health and well-being, not just during pregnancy, but all the time from newborns to, seniors. It works for everyone. And there are so many misconceptions about chiropractic care. And I think the more you know, the less you fear it and the less weird it seems. I mean, it's so normal to me, but then I'll talk to some people and I realize, this isn't normal for everyone.
That's what we call the chiropractic bubble. I just recently did that interview with Dr. Twyla, and she is a chiropractor. We were in school together, and which she didn't want me to mention just because she was like, I don't want to think back to those PTSD, like being back in school. But I was like, that's when we met. Oh. And I was like, we were in the chiropractic bubble where like everybody kind of
like, doesn't everybody think like this?
Yeah. And then you come out here and you're like, whoa, wait a minute. Because I hear a lot of varying statements from friends whose husband will not let their wife go to the chiropractor because they feel it is unsafe, and they are typically in the medical profession. I'm just going to throw that out there. I hear that most often than not. There's lots of things within that statement that I don't sit well with me, right?
I don't know if you want to go down that rabbit hole.
There's lots of things. But this discussion came about, and I guess we'll talk about this. So there's a few little myth busting things that we'll do in here. So there's one going to be like chiropractic may be dangerous for babies and pregnant women. We're going to go through that. The myth of like hypermobility in the child's spine. The myth of like adjustments being too forceful for pregnant women, and then also hypermobility in pregnancy, and if there's a problem and making that unsafe for women. So those are kind of the myths that I wanted to go through. Then we'll highlight some of the benefits, but this is based on, I don't know if I can link the actual article because it's in a magazine that I don't have like the rights to, and I don't think it's it's a publication from my malpractice, and so I pay for it, so I get this. Does that make sense? So I don't know if I can put it out there, but I've highlighted things. But my malpractice curious, it was like, yeah, of course you can talk about it. So that's where the article came from, and it's really good. They've got a lot of research kind of backed with it as well. So the first one that they had mentioned, or what we're talking about, is, and you may have heard this as far as chiropractic may be dangerous for babies. In the aspect of, sometimes I'll hear pediatricians or parents will come in and say, my pediatrician doesn't want me to go because it's not safe. Like just the blanket statement of that.
Blanket statement.
Yeah. And it's just kind of like, okay. So the first thing that comes to mind with that, or with some of the research, is that there's no actuarial data showing like an increase in adverse events from adjustments. And that like the millions of adjustments that occur every year, there's no like actuarial data associated, with that. So that's one aspect of it. The next one and I usually tell families this, is that right now and malpractice values and prices vary from company to company, and that type of thing, but they're typically hundreds to maybe just a few $1,000s. Mine's under $1,000 a year, my malpractice. So when you look at that compared to a medical profession, which if they are doing more invasive things and there are more risks involved with the care that they're giving, then their malpractice prices and values should reflect the risk. And that's exactly what is shown there. So, that's kind of the big ones that they had kind of talked about in that article, as far as like, well, there's no kind of research to back it up. And it's like,
let's flip that on its head.
Okay. Yeah. So it's, it's different. Now, with that being said, you're going to want to find trained professionals, because not everybody is trained to work with pediatric patients. I love when chiropractors know what their wheelhouse is and also know what it isn't. Because I constantly refer people out because they're just not the best patient for my office, and they need more support. They need more knowledge in another area. I don't do a lot of, car accident cases and all these type of things. So there's a lot different there. So it's also, knowing who you're taking your child to. But I guess there's the aspect of people are concerned about the force that's used with adjustments. And the newborn adjustment is I always tell parents, I'm like, it looks like I'm not doing anything, but I promise there's a lot going on here. It's very, very gentle. It should be very gentle, right? There should just be fingertips, use pads of the fingers for the adjustment. Sometimes there's a little bit of an impulse, like a vibrational, what we call like toggle recoil a little bit there, but it's still the pressure that you would use to like grab a tomato and test like the rightness of it. That's usually the reference that's given. It's very, very light. It's minimal force, with the intention of restoring like proper alignment and promoting optimal nervous system function with that. So just some of, I guess, the myth busting aspects in there. I guess when I was in school too, I never really thought about having to like pay malpractice. So that never came into like my budgeting mindset. And I'm like, oh, well, I'm glad I'm glad that it doesn't cost me that much.
Right, because there isn't really a lot of risk there, and that's
Uh-huh.
important to know. And we have these conversations too, because we encourage chiropractic care for our clients, and once their baby's here, for both them and their baby. And it'll be interesting. What I find sometimes interesting is when mom was under chiropractic care during pregnancy, and she's fine going, but then feeling apprehension around taking her new baby, because it's like, oh, they're so tiny, like, how is this going to
What's it going to
work?
look
And
like?
yeah, and sort of a lot of it's just like not really knowing. So we should try and shed light about how gentle those initial adjustments are and how beneficial it is for breastfeeding, digestion, and restoring that balance to their nervous system. So like we try and paint that picture, but you can't say it enough.
Now the next kind of thing is with the aspect of, children not necessarily needing adjustments. A lot of times people think there's like hypermobility, so they're already mobile. Do they really need it? And it's like, well, they're not, their spines aren't inherently hypermobile, but as they age and grow, there becomes that spinal flexibility but stability that goes with it. And so they have done some research on the forces used for adjustments varying from infants to teens, and that the chiropractic adjustments are performed with greater force at higher rates of that force application as the patient's age increases. So again, this is finding someone who's trained in working with children and pediatric spines as well, but the duration of the thrust, so like the speed, I guess, of that remained consistent upon age groups. It's not like that changed, but it was just a little bit like the force just changes there. But again, there's also different techniques that can be used. And so not every office is going to do kind of a hands-on manual adjusting. There's over 200 different adjusting techniques. Some are going to be instrument out there as well too, which you can get amazing results with that if the practitioner, I feel like, is trained and that's what they want to do. There's training with each of those adjustment types. So again, it's not like a superiority of adjustment type, but it's knowing that practitioner is trained in a certain thing and trained to work with the age of the spines that they are,
And
working with.
I feel like saying that because kids have more mobility than seniors, for example, or people who are older than them, means they don't need chiropractic care. It's like there are so many other things that could be going on for, to help balancing their nervous system, finding if they are tight. I mean, my youngest is consistently tight in his, sure, he's like super strong and super athletic and resilient. And I feel like he could just like bounce off the ground if he fell, but like he still has things that need to be balanced out in his body. And I'm like, why would I not want to do that just because he's youthful? Like, and then I remember Dr. Pam telling me, her language around with kids. Cause I'm like, I feel like we get adjusted and we leave. And then my kid will go jump off like a wall. And I'm like, oh, you just ruined that adjustment. And her phrasing or something like it was like, it helps them be more resilient to that fall, to that jump. So, you're not ruining it's actually preventing disruption when they do what they do, which is they're so physical. All I can ever think is ow. And it doesn't affect them the same because they're not older, but it still protects them. Like there's still so much benefit to balancing the body and nervous system. And anyways.
And again, too, I mean, I guess with this episode, it's like we talk a lot in other ones about the benefits of prenatal chiropractic and the benefits of pediatric, and there's all those other shows I know, or those other episodes we have. But this is kind of coming at with some of the hesitation and those myth busting things. So I like that
children
you
need
mentioned as far as that. Well, I mean, they are so active. And I have some people I have a lot of athletes that come in and they're kind of like, well, when, do you like to see the adjustments before or after an event or exercise, something? Well, kind of both. But if I had to pick, I would say before, because I really want that optimal brain body connection to occur before whatever that sporting event is. So then you have like optimal, what's going on. And then after the little micro traumas or whatever from the event, then it's like, okay, we can kind of piece things back together. But
and knowing that kids are not getting adjusted, like you said, with the same force that an adult is.
Mm-hmm.
Like there's appropriate care for age group. And I think
It's
this is
age
again putting some
dependent.
advocacy
Mm-hmm. Mm-hmm.
on the person seeking the care of understanding who, like you have said, like it's really important. Who is doing the care? Are they trained to work with young kids? Because they can't adjust everyone the same. And are they well prepared and trained to adjust the individual?
Right.
So
And there
seeking that
comes
out.
in there comes in that collaboration and communication
Mm-hmm.
with the parents and the kids. Like that is it. Because I'm also looking at it, I need to get permission from the kid and for their
Yeah.
body as well too. And I have, some kids that prefer adjustments a certain way, and I always honor that for whatever age comes in the
Mm-hmm.
office. Every time they come in is different. Sometimes they'll have, injuries where the care needs to be a little bit different one day than the other. Like
Mm-hmm.
it's the same thing with the adults as well too, but it's good collaboration and communication. And I want
Yes.
parents to feel comfortable to voice
Yeah.
their cares and concerns, because you never want, yes, I'm the doctor and I have this set of knowledge, but that doesn't mean that it's my way or the highway when it comes to certain things. Like if I could
Mm-mm.
use other tools in my toolbox for people to feel comfortable with adjustments or explaining it to a degree and a level that they feel comfortable with it, then that's part of my responsibility, as
Yeah.
well too.
So
So,
encouraging people to seek that type of provider who's going to offer
mhm.
information, provide individualized care, collaborate with you and or other professionals adjacent to you. So that's like, you can overcome some of these fears or myths or misnomers by just being the parent, just like you would regardless of what the kind of care they're getting wherever you are.
Okay, so now moving into a realm of like myth busting for prenatal care is maybe the statement of chiropractic adjustments being too forceful for pregnant women. And again, too, there's lots of ways to adjust. There's pregnancy specific chiropractic adjustments, though, and techniques like Webster that do prioritize safety and comfort for mom and baby. So, again, it's
Mm-hmm.
looking at like, okay, are you going to a trained professional who has worked with a pregnant spine and a pregnant body and knows how to
Mm-hmm.
do that? And even within Webster, there are levels and ways of adjusting. So sometimes with manual adjusting, sometimes people will have pregnant mom on her side. It's called a side lying, a way to adjust pelvis and sacrum. Sometimes what I typically have is mom is on belly with special pillows, and I have a table that has parts that pop up and drop down. So it's a Thompson technique. So it's a drop table. So I use that primarily with the pelvis and sacrum. But then I have the activator, which is a tool, which is a small
Mm-hmm.
handheld impulse tool, lots of different levels to that, which I can change the force of the adjustment on the speed. The
Mm-hmm.
duration is the same every time, but I can change the force on the little knob. So I'll use that on children. I'll use it all the
Mm-hmm.
way up to my bigger spines. I can use that. And then there's even part of one aspect of Webster that can be done if we do have really intense like hypermobility in the spine, because there are people are different. So there are going to be more
Mm-hmm.
hypomobile spines than others, but this is when you go to a practitioner who knows what they're doing. There's an adjustment that can be done where I am just placing pressure on the pelvis and mom moves and shimmies hips and does the adjustment herself. So it's within
Mm.
a realm of
You're
not
not
being so
forcing it.
forceful. So
Mm-hmm.
it's knowing those as well too, knowing that the goal is to align pelvis, sacrum to allow for optimal balance and function, but you can tailor this to pregnant mom's body and
Mm-hmm.
how you can see how they respond to. I have some people that respond way better to a more what we call tonal, as far as like the using the activator, using something that's lighter touch. I have people that respond way better to that than maybe
Mm-hmm.
more of the drop or the manual adjusting. Everybody's different.
Yeah. Just
Hmm.
everyone's different.
It's
Yeah.
just having those tools in your tool belt. And I like to ask for feedback from moms, because I'm like, okay,
Mm-hmm.
did we feel any muscle soreness or aches and pains, or what do we want? Or even if it's newly postpartum, I'm maybe not doing a lot of drops. I'm doing a lot more tonal
Yeah.
technique. I'm really balancing out craniosacral pump and all of that in a more peaceful, more calm manner with the nervous system.
Right.
So,
These are all great
um,
counterpoints to anyone that would say you shouldn't do
mhm,
chiropractic care because it's too forceful. Like, the more you know, period.
exactly. So, in line with that, maybe adjustments being too forceful for pregnant women, there's the hypermobility, the myth of that it can make the chiropractic adjustments unsafe. And we know that there's relaxin in there's a relaxin in your body, but then in pregnancy, it's really heightened to give that
Mm-hmm.
mobility to the joints where it's really needed as far as pelvis and sacrum. But I mean, it's needed everywhere because we've got that weight gain. We have that weight distribution change. We need the joints to be able to move differently and better
Mm-hmm.
with that as we incorporate the waddle and our gait changes and all
Mm-hmm.
of that. So, but as I guess the thing that some people don't realize, and I liked the wording in the article, was because it was talking about chiropractors have specific training to work within those physiological changes. So we have the training to
Mm-hmm.
work, if you've taken the Webster certification classes or working with pregnant spines, we have the training that's in there to make changes to how we adjust, when necessary. Again, the different
Mm-hmm.
adjusting techniques that I went over, and the gentle and precise adjustments can address that joint discomfort without compromising joint stability as
Mm-hmm.
well. So,
Yeah, that's important to know.
yeah. So it's just kind of a little bit of extra information. I feel like these are mostly myths that I get from if someone is taking their child to, or if they take their child to the pediatrician and they want to end up coming to the chiropractor, it's more from the medical community or medical side,
Mm-hmm.
as far as these are their issues with it. And sometimes those issues that they have come from people posting videos of adjustments. I'm not a big fan of that, in the aspect of wanting to get a reaction out of
Mm-hmm.
people, or those type of
Mm-hmm.
things. I have an adjustment that we're sharing on social media. I did an interview with Dr. Twyla and a newborn right after her home birth, but it's a beautiful video because it's an actual adjustment. It's not for like a wow factor. I feel like that's where, so sometimes I feel like the
Right.
medical community can
Different.
kind of, yeah, when you get it, I'm like, oh, it's not, not necessarily how things happen or what's really
Yeah, that's
going
that
on here.
misunderstood, that misconception. It's using it in a way that's spreading fear versus
Yeah.
understanding. And this happens with every aspect, I feel like, of
Mm-hmm.
life, of where the extreme points, and they get the looks and they get the
Mm-hmm.
shocks and they get the likes, and then that is harder to overcome when you are,
Mm-hmm.
trying to do what you're doing, which is
Mm-hmm.
overcome the myths and overcome the fear and overcome
Overcome
the
that.
misconception. So
Yeah.
that's why you
So
guys
I
got
feel
to
like
keep spreading the good word.
exactly that's what we're doing here. So that's what I feel like this is more geared toward. And I know. So I really do. And I really like my malpractice carrier because I use Chiro Futures because they're very prenatal pediatric friendly. They're very subluxation based, really looking at nervous system function. They put out a lot of research. They put out a lot of articles, and they just have a lot of really good information. So I do like
That's
having,
awesome.
I know, I do like really having them as my malpractice carrier. But to end with some of the benefits of care during pregnancy. And like I said, we have a ton of episodes on this. I don't have anything in my mind of if I can recall quickly of like, oh, an episode that we've had. But I know there's always a big pain relief aspect in it, and having people come and visit for low back pain, sciatica, pelvic pain, round ligament, all those different pain points. In addition to alleviating those pain points, there's the enhancement of that overall well-being by impacting spinal alignment and then positively impacting nervous system and how it functions, and then looking at and helping that brain-body-body-brain connection, and then helping to adapt to the physiological changes. I think that's a big part where people will come in pain, and it's like I'm trying to get them to that understanding of, with care, we're able to now adapt to our stressors. We can't necessarily get rid of all the stressors in our life, but
Mm-hmm.
can we adapt to them better? And so that's
Mm-hmm.
where coming at care and that prenatal care, where I try to get people to. Sometimes it takes a minute to like get out of that pain mode and get them into that wellness mode.
Yeah.
But yeah.
Yeah.
And I'll link, they've got
What?
3 different research articles that they had pulled from in fact, some of them, it's going to be
Okay.
the best practices for prenatal care, best practices for pediatric care, which
Mm-hmm.
when I was in school, I was one of the folks that helped collect the data. So that was actually one of the things I did. So I helped
You were
collect
part
the
of that.
data so I was part of those research papers, which is kind of fun, but it was collecting,
Nice.
because it's almost like a literature review. So collecting all the information that's been published that's already been published about it, gathering all of that. So then you can write a best practices chapter for a book as far as like evidence-based care. So that's where some of the stuff comes from.
So awesome, Shannon.
Yay.
Can't wait to dive into those deeper. And I hope our listeners will dive into those deeper. And I know definitely there has been lots of things learned in this episode. Seeds planted, hopefully fears reduced,
fears
myths
reduced,
busted. Here we go. Go find yourself a Dr. Shannon, because you need one. We all need one. And thank you so much for sharing all of your wisdom. It's been so fun listening and learning with you today. And listeners, we hope you'll tune in next week for a brand new episode.
Thank you for joining us on the Aligned Birth Podcast. We hope you found our discussions informative, inspiring, and enjoyable. Remember, when your body, mind, and intuition are aligned, you have the power to overcome any challenge that comes your way. We appreciate your support and leaving a review or rating, signing up for our newsletter, or becoming a direct listener supporter. Your contribution helps us continue delivering valuable content and reaching more listeners like yourself. Stay connected with us through our newsletter to receive the latest episodes and bonuses straight to your inbox each week. You can also connect with us on Instagram at aligned_birth. All links can be found in the show notes. Together, we can make a difference in the lives of the birthing individuals and new moms. Thank you for being a part of our community. We look forward to sharing more empowering conversations on the Aligned Birth Podcast. Until next time.